Well, why don't we go ahead and get started? Nice to see everyone. Good morning. Thanks for coming. I'm Lydia Chwastiak. I'm a psychiatrist at UW at Harborview, professor in the Department of Psychiatry, and the co-director of the UW BIRCH Center. And so I'm delighted to welcome you all here to our first session that relates to translating and disseminating research findings for broader audiences. We're really excited about this series. So we're very excited to have Jeff Lane present this 90-minute workshop this morning. And I just wanted to say a few minutes before I introduce Jeff and turn things over to him. I just want to say a few things about the BIRCH Center and our wonderful partnering centers in the Department of Global Health. Just so you all are aware of who's sponsoring this session. So if you don't know, the BIRCH Center is the Behavioral Research Center for HIV. We're an NIMH-funded 4-year developmental AIDS research center, and it's a wonderful collaboration. The center sits in the Department of Global Health. Our PI and director is Susan Graham, an HIV physician in global health. And as I said, I co-direct the center, but it's a great center across global health, a couple of other schools in the School of Public Health, the Department of Psychiatry and Medicine in the School of Medicine, School of Psychology, and the School of Social Work. And the aim is to support, there are a number of, you may be familiar with the CFAR, there are a number of AIDS research centers that are funded by other NIH institutes. We're funded by NIMH to specifically support research that focuses on the NIMH priority research areas. So you can find some more information about us on our website. Our mission is to catalyze multidisciplinary research on innovative, impactful, and equitable interventions to promote the integration of behavioral health and HIV and prevention treatment across the lifespan and across the HIV care continuum. So wanted to tell you a little bit about BIRCH because this is the structure of BIRCH. We have 2 research cores, and one of them is the Integrated Care Core. And I just wanted to acknowledge one of my colleagues, Anjali Wagner, who is on who's one of our core faculty on the Integrated Care Core. And these policy workshops were really kind of her brainchild. And so she's not with us today because she's traveling. I think she's in Kenya right now, but really wanted to give a shout out to her because she's really brought together a wonderful group of partnering centers to develop really a series of workshops. So I hope you're all aware of, this is our first session. We're planning to do 4 to 6 sessions through kind of the end of the winter. So we have the first 2 scheduled, Jeff's today, and Kelly List from WACh will be presenting in 2 weeks. You should already have received that invitation. I hope many of you have already signed up for it. But we're really kind of bringing this together, a lot of expertise out of the Department of Global Health. I want to kind of acknowledge our big sister center, the CFAR, and specifically their RAISE Implementation Science Hub. iTech, Jeff, a lot of iTech folks here today is partnering on this, as well as WACh and their implementation arm WISE, and the LAPIS Center Global Mental Health and Implementation Science Program. So as I said, we're going to do a series of workshops. They're really going to focus on one of the aims of our Integrated Care Core from BIRCH is to be able to translate our research findings to broader audiences. So Jeff is going to be talking about policy briefs, and Kelly's going to be with us in 2 weeks to present a dissemination toolkit that comes out of WACh. So really excited about that presentation. And at the end of Jeff's presentation, we'll have an evaluation form and really want you to take a look at that because we're looking for your feedback to kind of shape the content and the structure of the subsequent sessions that we're going to do throughout the fall and winter. So with that introduction, I can turn things over to Jeff, my colleague Jeff Lane, who is an assistant professor in the Department of Global Health. And he's now faculty director of UW's International Training and Education Center for Health, or iTech, and part of the Global Medicines Program. His research interests focus on how law and policy impact health around the world, with a focus on health workforce and access to essential medicines. During his career, Jeff has worked on health policy strengthening projects in multiple countries, including Cambodia, Kenya, South Africa, Ukraine, and the US. He's also worked with state and federal legislatures in the U.S., including serving in the Legislative Affairs and Communications Manager for the Idaho Division of Public Health from 2021 to 2023, which must have been an interesting time. Jeff teaches a course titled Policy Development and Advocacy for Global Health every spring that includes a focus on policy brief writing, and he's developed an online professional development version of that course with EDGH that's been taken by more than 5,000 health professionals around the world. So very excited to have Jeff with us today to share his expertise. So I'll turn it over to Jeff to kind of provide the session.
So just a little outline for the session today. So I'm going to give a very quick intro to public policy, just to kind of ground us and what do we mean when we're talking about policy. Then I'm going to give a very high-level overview of persuasive communications. That's just some key things to keep in mind when you're trying to be effective in communicating. Then we're going to talk about policy brief writing and design tips. And then we're going to jump into Word and Excel and actually build something. So if you have a laptop, it's not required today. You can pull that up and you can pull up the PDFs of those sample briefs that we're going to look at. But I think in particular, what might be even more helpful is that Excel file, and we'll kind of go through some things together. Some of that's going to be a little basic for some of you, but I do think that there's some tricks within Word and Excel. And what I'm going to try to make the case to you today about is that that is all you need to make a really good policy brief. And I'm going to show you how to do that. All right. So when we talk about communications and policy, I always like to start with this quote. So this was from Dr. Martin Luther King Jr., and he said, "People fail to get along with each other because they fear each other. They fear each other because they don't know each other. They don't know each other because they have not properly communicated with each other." And to me, I think this comes up a lot in the policy space, which is we struggle oftentimes with trying to communicate with other parties for various different reasons, and we have a lack of understanding. Fundamentally, from my perspective, a policy brief, it is a mechanism for communicating with people. There are lots of different ways to do this. If you take my policy class, we'll talk about how you can do this with longer presentations, about how you can do it in legislative testimony. We only get 2 or 3 minutes. There's the elevator speech. There are websites and blogs. There's different ways to communicate with people to try to overcome some of these barriers. A policy brief is one tool. It's an important tool, and we'll talk about why, but let's keep in mind that there are many others, and many of the principles and suggestions I'm going to make today, they apply across these different communication modes, right? So we're gonna focus on policy briefs today, but there are other mechanisms that you can think about for communication. So some of the things in particular when we're talking about policy briefs, so this is going to be a short written document that you're using to convey some sort of a research finding or policy recommendation to a policymaker. There's some, I think, important contextual things to think about, which makes us, I think, should make us rethink how we frame some of these things and how we communicate with a particular audience. So for policymakers, oftentimes you're communicating with people who you may disagree with on important areas of policy. That is, I think, a really important part of this. So policy briefs are not just intended to go to people who agree with you, right? Sometimes it will be. Sometimes you're trying to build a champion who you think is on your side, and you're trying to educate them a little bit more and around a particular issue. But oftentimes, where they make the biggest difference is where you're kind of reaching those people kind of on the fence, one way or the other, right? And some of those you might have very significant disagreements with. They're very busy. At most, you might get 5 or 10 minutes of their time to go through a brief. So that's why it's titled "Keep It Brief." Many policy forms of communication, it is really about distilling something down into its most sort of simple form so you can connect with that audience. And so really trying to be succinct is super important. They have many priorities, not just the issue or condition or population that you're focusing on, and not just public health, right? So depending on their area, if it's an elected representative, they might be on the health committee, but also the transportation committee and the pension committee, right? The public parks committee. There could have lots of different areas, lots of different constituents asking for different things. And so you have to keep in mind that while it might be your number one priority, they have many other things that they may be focusing on. That will vary depending on the type of policymaker, but being thoughtful about that is, I think, important. They may have different experience than you or different information than you, right? So you might be a subject matter expert in a particular area. You might have lived experience with a particular issue or condition. They may not have that, right? And so you need to know that ahead of time. So you think about understanding and being thoughtful about how much background information you put in a brief. Sometimes it could be a physician who's on the health committee and they understand an issue even better than you do, right? And you want to acknowledge and respect that experience and expertise that they bring, but you just want to be thoughtful about that. And I think this is something that I think about a lot. They may be very skeptical of your recommendation. When I'm thinking about policy writing, I think about trying to write to the skeptical audience of someone who's trying to find something to disagree with or pull out. And we're trying to not give them anything to grab onto that they can use to try to oppose your recommendation. So we need to kind of balance this about being really succinct, but also giving enough, being thoughtful enough about the background that we give and so on, that we're really making a strong case, right? Because there will be people who will try to poke holes into many of your recommendations, and you want to be thinking about that ahead of time. So when we think about public policy, there's different definitions out there, and I just like to use this one. And so this definition, it defines it as a plan for future action adopted by a governmental entity that is formulated through a political process as a response to a problem perceived by one or more stakeholders. We could really dig into this and spend a whole hour on just kind of parsing this out. But I think some of the key points here is that policy is fundamentally forward-looking, right? It's laying out a plan for how the government is going to respond to something. But it's also adopted through a political process in response to problems that stakeholders perceive. The way those problems can be defined can vary quite a bit. You can have a lot of disagreement about what should be the highest priority problem to focus on or what the cause of a particular problem is. So all this background about how you sort of define what's leading to that public policy can be important, but being thoughtful that it is an ongoing process and there's this constant churn about trying to identify solutions, then arguing about what the problem is, coming up with solutions to that new problem, and so on. So this is kind of the policy process, which I just kind of laid out here. But the idea is that you kind of start off with the stakeholders, you identify your problem, you develop these governmental activities or interventions. You then adopt the policy, the government adopts the policy. You then go through an implementation phase, and there can be different variations in fidelity, right, at this step here. And then you end with either a formal or informal evaluation of how well it's going, and that feeds into a new problem statement. This is the public policy process cycle. Private organizations can also adopt policies, right? It is just a little bit different in that in democratic societies, there are elections and votes and elected representatives who then inform that process. Private organizations will have their own set of policy development processes, and they can vary quite a bit. So today I'm going to focus on public policy, so governmental interventions, but that doesn't mean that private policy is not important for public health or mental health. I think it very much is. But just recognizing those processes and that cycle might look a little bit different than this. And so policy advocacy is really a political process of individuals or groups which aims to influence the public policy process. So it can happen at really any of these stages here, right? So at the defining public health problems, coming up with interventions, the adoption, the implementation phase, and even the evaluation phase, right? Advocacy can happen at any one of those steps. And a brief can be a very useful mechanism for trying to influence the policy process through advocacy. Again, very high level hierarchy of different types of policies. So in most places, the highest level or the most sort of what trumps everything else is going to be the Constitution. Below that, you're going to have statutes that are adopted by legislatures. Statutes, not statutes, but policy regulations are then the next level down. Those are going to be adopted by administrative agencies, departments of health, ministries of health. Then you have strategies, which are kind of medium-term policies for kind of 3 to 5 years, how the government's going to try to address a particular issue. And then kind of below that, you have guidelines and standard operating procedures, which are kind of implementation guides for implementers. Somewhat separate from that in the policy space, most places will have an annual or biannual budget process, which is separate. So you can get a you can get a statute passed that calls for a new program, but then every year, 2 years, you need to go and get that funded. And that runs through a separate bill, budget bill, or budget bills that you then need to advocate for on that budget cycle. And then many places also have an integrated planning process where you have local districts or local facilities that they're looking at all these different policies that are being adopted around mental health or HIV, heart disease, and they figure out, well, how do we integrate all this into our day-to-day activities, right? So that's kind of this integrated planning process, which is another key policy step. So in addition to this, right, there's sort of that hierarchy of types of policies. But there's also different levels of policymaking. So it can happen at the national or federal level, the state or provincial level, depending on the country that you're in. Potentially below that, there's a county level, and then there's municipal or city level. Each of these could potentially be the target for a policy brief, right? And it would be thoughtful. Sometimes you can get something through at the city level that you can't get through at the provincial level, right? And sometimes it's vice versa. You can never get it through the city government for some reason, but you can potentially get it through the provincial government. So you want to be kind of thoughtful about that. And the brief that you might write for the city council could look very different than you write for the governor's chief of staff, right? For a lot of different reasons. But we just want to be thoughtful about, we want to know which level we're targeting when we write our brief. All right. So I went through that very fast. So now I'm going to ask you all a question. So what are some examples? So BIRCH is our main sponsor here today, right? What are some examples of mental health policies that you might want to write a brief about, or policies that affect mental health?
Mandatory reporting.
Mandatory reporting of?
Homicidal intent.
Great. So, just in case the recording couldn't hear, so mandatory reporting of suicidality of a patient. So maybe a provider might have that, a legal obligation to do that. Thanks.
Mandated insurance coverage.
Mandated health insurance coverage. So maybe, federal law that would require individuals to have insurance, or maybe require employers to provide insurance for their employees.
Or ensure that mental health is part of that insurance. In some other countries, it's not a single this.
Great. So a law that says that private health insurance plans have to include benefits for mental health coverage. Great. Yeah.
Access of minors' health records for mental health.
So laws around who can access a minor's mental health records, right? So oftentimes there are protections in law that prevent sort of disclosure of those to certain individuals. Great.
Or access to behavioral health records separate from medical records.
And just broader access to behavioral health records. Great. Separate from medical records. Yeah.
That's the shifting of mental services.
So task shifting of mental health services. So can a particular cadre of health worker provide certain type of services? Is that within their scope of practice for them to be able to do? Great. Any others?
Involuntary treatment substances.
Sorry, say it again.
Restriction of controlled substances.
So laws around use of controlled substances and what happens if you're caught with them and you don't have a prescription, right? Right. And Lydia, were you gonna add another?
Involuntary treatment.
Involuntary treatment. So someone who is who's forced to go into mental health treatment or maybe be institutionalized to receive that treatment sort of through the court system, what those rules are. Yeah.
Listen, they said mitigating suicide, settings where suicide is criminalized. Mitigation of suicide.
Yeah. So laws relating to suicide. So there could be criminal provisions relating to that. And governments can also just have policies around suicide prevention, right? So I work at the Idaho Suicide Prevention Program, and there are various sort of policies that they've adopted to try to reduce the suicides. Great. One more. Yeah.
The 988 hotline, it was financed through the policymaking that like every single phone user, they would charge for that program.
Yeah, great example. So the 988 line. So this is it's a national helpline for people in mental health crisis or need mental support. A federal law established that. So that was And that had actually very strong bipartisan support in Congress. It was actually it was very interesting. I was working at the Idaho Department of Health when that was rolling out, actually. And so some states had those things, but this really standardized this. It's the same number across the country. Thank you.
I was just gonna say, a lot of the ongoing research around regulating big tech for adolescent mental health, specifically around like social media access and the predatory policies that they have.
Yeah, so regulations around minors' access to online content or social media, great, and the effect that might have on their mental health. Great.
And I just want to add to the 988, right, the federal policy, but it's implemented so differently across states. You know, driven by state policies, resources, their own kind of laws and regulations around crisis services. So it's a really interesting example.
Yeah, a lot of that has happened, is implemented at the state level. A lot of it was being implemented by state policies before that passed. And so you have this sort of like interesting overlay. Yeah.
Adding like sort of infrastructure for mental health. I know that like sometimes there's government funded facilities, and in some countries that's common, and in some countries that's less common. So, and yeah, sometimes they're all private. So I don't actually know how that works, but I know that there's a variety, and policy is probably.
Yeah. I think in many ways, absolutely, right? So does the government operate mental health hospitals or outpatient facilities, right? Do they maybe fund other organizations to operate those things? So that kind of direct service delivery is also quite important. And then funding the upkeep of those facilities or their expansion, which has been another, I think, focus in a lot of states recently in the US.
One more if you go on, but just even within the US, thinking about Medicaid, you know, the public mental health system driven by Medicaid, so different across states. The states that haven't expanded Medicaid and the impact on access to services. So thinking about Medicaid across states, Medicaid expansion.
Yeah, so the Medicaid coverage overall, and then states, right, have some flexibility about what they cover under Medicaid, and there's a whole really complicated process around that, but you can have variations both in what's covered and who's covered under Medicaid by state, even though it's a federal program. So yeah, a lot of great examples there. So these are just some kind of big categories to think about for different types of policies, right? You've got and these are kind of activities that governments do, right? Things governments can do about different public health problems. So they are public health and healthcare service provider. So they operate facilities, right? Whether either outpatient or inpatient. They could fund other organizations to do that. They give a grant to a federally qualified health center to operate a mental health counseling program, right? They're regulator of private activity. So licensing laws for nurses that are defined at the state or national level basically says, well, private nurse, here's what you can do in the realm of mental health that's within the scope of your license. They have a taxing authority, and this comes up in some areas more than others, but the government could establish instead of requiring health insurance, the government could give a tax write-off or deduction or credit to employers to provide health insurance, and that health insurance would maybe have to include mental health services. So there's different ways to kind of use tax policy to influence behavior in society. They're a healthcare purchaser and payer, so Medicare and Medicaid, right, in the US, the NHIF in Kenya, National Hospital Insurance Fund. These are public health programs that both where the government is covering services and then also purchasing healthcare services for their employees. And this is a big deal in many countries. The biggest population of people with health insurance are public employees. And so that is a big lever the government can sort of influence. They say, when you serve our patients, you have to be able to do A, B, and C. Then oftentimes that ends up spreading to even people who are not beneficiaries of that particular plan. And there's criminalization laws. We heard about some of those, right? If you engage in certain activity, you're caught in possession of a controlled substance, you don't have a prescription, you can go to jail, or maybe you go to a diversion program, right? And sort of how are those laws set up around criminalization laws? So these are just kind of some examples of the different types of policies that might come up. One of the most important things from my perspective, when we're thinking about how do we translate research into policy, is to be thinking about these things at the very beginning of your conceptualization process of your study. So understanding what are the policies that are in place today, right? How these various different levers, And then you're looking at, well, if we were to tweak one of those in a particular way, what's the effect of that going to be? You can then talk to policymakers, you can involve them in sort of in how you design the study and what questions you'll be able to answer. So at the end, your results are then going to inform, should they tweak a particular policy or not, right? You don't want to be thinking about this after your study results have come out, but if you haven't yet, it's still okay to do it then. But ideally, you're doing that early. And this is sort of part of your background or situational analysis about what's already in effect. All right. So that's just a little bit super high level intro to public policy. But we've all now got that foundation. So let's move into persuasive communication. So for dissemination, Kelly's going to give a session in a couple weeks talking about dissemination toolkit. So definitely encourage you to come to that session as well. This is a resource I really like too. It's from the community toolbox. And it talks about the sort of section 2 of the toolbox talks about using principles of persuasion. I think it has a really nice overview, and I'm just going to touch on some high points here, but it's about how to use behavioral science to influence people. And they talk about the ethics of that, little things you can do here and there about how you persuade people. But there's some high-level principles that cut across a lot of the evidence around how to be an effective communicator, to persuade people to do certain things. So fundamentally, from my perspective, persuasive communication, it just allows you to connect with key stakeholders. We're not trying to convince people to do something they don't want to do. We're just trying to give them information to help them make the most informed decision. That's how I view policy advocacy. It is not, we're not trying to do a sales job. It is just providing information in a way that's going to help connect that information with their interests, right? One of the key steps you're going to hear in just about every persuasive communication article or book that you read is you need to identify your key audience, right? This is going to be a group, and oftentimes you have a primary audience, and then you might have a secondary audience. So an example, you might have adolescents as a primary audience for a particular mass communication campaign, but you might have a secondary audience being their caregivers, right? Maybe the adolescents are sort of the primary one, but there's also this related community that you're going to be focusing on too. For policymakers, it may be the chair of a particular health committee in a legislature. But the secondary audience is going to be other members of the health committee, right? So you're focusing on the primary one, but you have to recognize typically when you write a brief and you put that out there, it can move around. And so while you do want to speak to those primary interests, you want to be cognizant that other groups will read that. And so you do need to keep that in mind as you're designing a brief. So identifying your key or primary audience is the first step, but it doesn't matter unless you take the time to listen to them to understand their interests. We don't want to make assumptions about what they care about, what their goals are. We want to actually talk to them. And this is where that quote at the beginning, I think is really important, because I must say, in much of my work around this, there are people who just don't want to talk to each other for many different reasons. And overcoming those barriers and having those kind of difficult conversations at times is super important to good policy work. Generally speaking, we're oftentimes not just trying to convince people who agree with us. We're trying to persuade and convince people who don't agree with us. And in order to do that, you have to have conversations with folks that you might disagree with a lot of what they stand for, but that might be the difference about your bill getting out of committee or whether or not the director is going to sign off on the new guidelines. And so being able to have those conversations and understanding their goals and interests, and then factoring that into your approach is a critical part of this. So establish credibility. You're going to see this a lot in the literature too. So someone is going to ask, they get pitches all the time, policymakers, right? They're going to know, does this person know what they're talking about, right? And there's different ways to build your credibility, right? So something we do at the beginning of many lectures is we have someone introduce the speaker, right? And that person is basically laying out the credibility of the speaker, right? So that, if this person knows what they're talking about or not. So when you get up and you give testimony, you introduce yourself. You can talk about your years of experience, the organization you're associated with, your degrees. You can put that in a brief in different ways, right? You can have your logo at the bottom. You can build your credibility outside the brief, but somehow you need to be able to show that you know what you're talking about and they should be listening to you and maybe a little less to other people. That's kind of the implication of that, right? Frame common ground. So similarity of interest, that's been shown a lot to help with persuasive communication. So showing about kind of where you have common interests and overlap, how things can be kind of win-wins. This is a really, I think, useful tactic. And so to do this, again, you need to understand that primary audience and what their interests and goals are. Provide evidence, right? This is the business that we're in for the most part at the UW, right? Generating that evidence to underpin what our recommendations are. This one is important. It may not be as important as researchers may like, right? So there's a good amount of evidence out there. The evidence doesn't help a lot. I don't know what we should make of that study, but the idea is that policymakers, they're motivated by lots of different interests and goals, and the results of a clinical trial and so on is not necessarily going to be the highest priority for them. Doesn't mean we don't provide it. I think that can really inform people, but we shouldn't present a policy brief and show that the p-value was significant at 0.01 and just expect it's going to get passed. There are a lot of other interests that are going to determine whether or not a policymaker is going to support what you're trying to do. So present it, but don't kind of put all your eggs in this basket. And then connect emotionally. There's different ways to do that. Storytelling can be a fantastic way to do that. Building relationships with policymakers can be a great way to do that. Sort of showing your humanity and getting to know them a little bit can be really effective. This, I think, is a really important step, but sort of like the last one, you don't want to overdo this. So if you're presenting to the director of, the HIV program in a particular country, they know the ravages of HIV, right? You don't need to start off and kind of give a 5-minute overview of how challenging the situation could be for someone living with HIV in their country, right? They might know that. So you want to be targeted in how you try to connect emotionally. You want to be, I think, there's times when it can make sense to go into those longer stories for audiences that don't have as much familiarity, but you just want to be thoughtful, because if these are professionals and if they feel like you're trying to manipulate them, that can cause some backlash. So I see this overdone a little bit at times, and so I present this with just a little bit of word of caution that use this approach, but use it strategically. All right. Should we get into talking about policy briefs now? Okay. Any questions on anything that I've presented so far?
Just say where that toolkit came from. Is that publicly available information?
It is, yeah. So if you Google it, you'll yeah, sorry. And some of these tips. So if you go to this one, it's just a community toolbox. If you Google it, you'll find this. There's a kind of an article or this section, but there's a video here that is really nice if you're interested in sort of behavioral economics or behavioral science. It's just fascinating. I think about all the little things that we can do to affect people's behaviors. Sometimes it's not particularly focused on public health or mental health, so you have to connect on these things, but I think it's a nice resource. Any other questions? All right. So we are going to start off here with 10 tips for developing effective policy briefs. And we'll share these slides. You don't have to write them down. And I will say the overarching sort of the golden rule, I would say, of writing policy briefs is write to your audience. So if I'm going to present something today that doesn't feel like that's not how a particular policymaker that how they like to receive their information, then you should go with how they like to receive their information. How do you know how they like to receive information? You ask them. That's a totally legitimate question. Say, what is the best way for us to share information with you about our program or our study? They say, is there an example of a brief and they say a brief. Let's say, well, do you have an example of one that you really like that would be useful? I think people like it when you're asking them about what is the most efficient way that they want to get their information. I think people tend to respond to that well. That's a totally reasonable thing to ask. So keep this in mind. These are some suggestions based on my work. but know your context, know your audience, and make sure you're writing to that. So number one, word processing software. So MS Word, other sort of word processing systems is all you need to write a really good policy brief. Others like Tableau, Pictochart, Canva, they've got nice features, but they take time to learn. There can be some subscription costs for those. Some of them are really quite affordable. So if you haven't looked like Pictochart or Canva, there's like an education rate. It's really not that much. But I don't think you need those to do a really good policy brief. And I think if you spend a lot of time with them and you learn the templates, you might be able to save some time and it might have a little bit more polish when it comes out. But those are largely template based. And so if you can't find the perfect template in there, you end up having to move stuff around and it gets really complicated. So I think it makes more sense to start from scratch and have a template you go back to that you really like, but not trying to use the templates in some of those other programs. People may have other experiences with that, but that's just been my experience. State the main recommendation of the brief in the title of the brief, in the first sentence of the brief, and in the last sentence of the brief. So policymakers, they're going to want to know if you have credibility, right? If they're gonna believe what you have to say, their first question is going to be, so what do you want me to do? So what is your ask, right? And they might just look at the title of your brief before they walk into a committee hearing or walk into a technical working group meeting. That might be all they get. And you want to be able to give it to them right there. In a 2-page brief, which is what I tend to recommend, I'd say one's better than 2. 1 is really tough, though, to do well, I think. 2 is right front and back of a piece of paper. That's having a nice little executive summary at the top right there, having a recommendation in that first one, and then at the very end to bring it back together is super important. Keep the brief to 2 pages and link to a website with more information using a QR code. This is a great mechanism. We're seeing it more and more. I'll show you how to do this in a bit, but you can't fit everything you're going to want on a 2-page brief. So have a background paper and just link to that as part of the brief. You can have it so they can use their phone. It's a nice little trick to both give it to them, keep it brief, but then allow them to do follow-up, or maybe members of their staff or their deputy or their manager might then follow up with a longer paper. So include important references in the brief to build your credibility, like I talked about before, but then link to a longer paper website with more references, right? So this is one that I think is important. I'd say kind of 3 to 5 references in your brief, but everything else uses that, put in that secondary resource. Keep your sentences as short as possible and avoid acronyms at almost all costs. So acronyms are a great tool for a community that regularly uses the same term, and it's a shorthand, right? So if the folks in your study team use an acronym a lot, that can be great. But now you're presenting to an audience that doesn't use it all the time. And there's nothing, I think, more frustrating when you're reading a brief and you get to like the second paragraph and there's an acronym and you can't remember what it stands for. You got to go back to the top. And a policymaker, it will oftentimes just move on. So even if it's long, there's different shorthand ways to do that. So, many industries love acronyms. It's not just the public health thing, but I would say really, really trying to avoid that at all costs for policy briefs. The other thing is, policy is oftentimes abstract, and I think the smaller chunks that we can break things into, the better. So keep your sentences as short as possible, like 10 words or less, right? Like the shorter, the better. Like a 3-word sentence is awesome. That can be the most powerful sentence in your brief. So I would literally go through it and highlight it. And if it's getting over 10, 15 words, really think about breaking that up. All right. Tip number 6. So use columns to help organize the content of your brief, and then text boxes, data callouts, and icons to break up the text. So we'll talk about what those things are, those sort of the data callouts and so on. But when you're starting from scratch and you're developing a brief, whether it's a programmatic brief, a policy brief, a community brief, I think it's helpful to think about it as columns. I like to think of them as 3 columns. You can also think of them as 2, and you're just filling in those spaces. So I'll show you how to do that within Word, but I think a policy brief is most effective. I think if you have a combination of narrative and then these data callouts that emphasize these key points, as opposed to just an infographic, because infographics, you can, things like Canva and Pictochart are great at infographics. If you're going to do that, I think actually that would probably be a really great tool to use. It's hard to integrate the narrative text into those. And oftentimes you're going to want a little bit more explanation about your recommendation in the background than you can get with an infographic. The one other caveat I would add for this is make sure your brief has a logical flow. So if you overdo the text boxes and that sort of thing, someone holds it up and you've got 6 different text boxes, right? And that's it. The reaction would be kind of, well, where do I start? And so you want to kind of lead them through it. So in English and in many languages, right, you start at the top and you read left to right. So have a header and start near left and go down and make it clear that these data callouts and text boxes, they fit within the narrative text. And so don't make them guess about where they should be reading. So these are some basic things about if you're going to have a figure and that sort of thing, refer to the figure in the text, right? So just make it easy as possible for the reader so they don't get lost and they catch all the key parts of your brief. Photos and images can be really powerful. I think it's going to be a really effective thing to use, but make sure you have permission to use them. So a lot of the systems you have online, there's various different rights and so on. So just kind of do your due diligence and make sure you've got the rights that you need to use those photos and those icons. But there are a lot of options out there that are really quite affordable now to get really good photos. Take the time to remake figures and graphs with the color scheme of the brief. This is I think this is one of the biggest ones that really shows sort of the different levels of sort of how professional a brief looks. If that graph aligns with, or the figure aligns with the color scheme of the brief, it looks super polished and professional. If you clip something and you put it in there, it looks like you clip something and you put it in there. The resolution gets thrown off. Oftentimes, it's not set up for that type of medium. And so taking the time to do this, even if you're approximating it a little bit, as long as your graph is clear and accurate, you never want to be misleading, but you do have some, you don't have to have all the same level of detail that you would in a graph in a peer-reviewed manuscript that you would in a brief. So as long as it's clear and not misleading, I think it's really helpful to remake that, and I'll show you how to do that. So Excel and other sort of programs like Excel, they've got nice map and other data visualization features. Has anyone here ever used the map feature in Excel? Very good. All right, so we'll all learn how to do this by the end of today. I think it's amazing. I think it's kind of new. And we used it in a brief a couple years ago, and that bill got passed. So we've got evidence that it works. So I'll show you how to do that. It's a really great tip. Policymakers love maps. So for a variety of reasons, if they're sort of a district or provincial policymaker, they know their district and they want to kind of see if it's a heat map, they go right to where their district is. If they're an elected representative, depending on the country and so on, they've got particular constituents who vote from a particular part of the country, and they go and they look at their district, right? So maps are a really effective data visualization tool for policymakers. And then lastly, modify your figure formatting from the defaults to focus the reader on the most important information. So this is, I think, again, a lot of this goes to graphs, but other types of figures as well. Some of the key things that I think make a big difference. And if you look at like really graphically designed, professionally done reports, what they often will do is they simplify the figure, they bold the text, and then I love this one, and it's not done enough, I don't think, but so I keep pushing it. Title the figure with the key takeaway of the figure. So don't just say, prevalence of depression from 2020 to 2023, say prevalence of depression has doubled in the last 3 years. Underneath that, you can have your traditional, overview prevalence rates of depression during a certain period of time, but give the reader that takeaway, right? They're not there to study your graph and to critique it and give you peer review. You're trying to just convey a key takeaway, a key message to that reader. So help them with that, right? All right. Any questions on these 10 tips for designing effective policy briefs before we look at some examples? Does anyone want to disagree with any of these? Yes, Kate would like to disagree. Go ahead.
When I work with principal investigators on our team, there's often like a certain orthodoxy around the language and a certain reluctance to make like inferences on on some of the research. And I think that's always a challenge when trying to strike this balance between like simple language, but also language that they feel is precise enough to kind of go to their credibility. And I guess, do you have any approaches or tips for a process that can be used to kind of get to a happy medium or to convince them to simplify maybe beyond the space of it?
So I said it's a common issue, right? And it's not just researchers. So even if you talk to programmatic folks who work in a Department of Health, they're writing a brief that's going to legislators. The last thing that they want to do is be accused of being misleading, right? They're super concerned about their credibility. And so I think it's a very legitimate concern. So I don't have a great recommendation on that, to recognize that it is an issue and kind of talking through it. I think having a group of folks who do regularly, work with that audience, can be useful sometimes. That's, I think, about as much as I can think about. Yeah, but it's an important point. I think, and there are people who will be a little more fast and loose. And in research, we don't necessarily want to do that. We can't, and this is kind of why I was talking about before, having the conversations with the policymakers in advance of the study, because you can say, well, I want to really be able to say, the policymaker might want to say, I want to say X, and say, well, you can't say X. We didn't design the study exactly to say X. You could say like Y, but and so that is just a balance you have to strike. I do think there's as a lawyer, I would say there are ways to frame things in a way that are accurate, and you don't say, I swear to tell, the truth, the whole truth, and nothing but the truth. It's like, you don't want to be misleading, but you don't have to give them everything, right? And I do think one of those nice references back to a peer review manuscript or to other sources, another nice way to say, this is kind of the summary, but there's a more in-depth, nuanced picture of this that you can find here, and that could be a nice way to maybe switch some of those.
Wondering how come up with an audio policy for audience that have that preference from the stakeholders. Audio, this is visual.
Oh, have an audio? Yeah, I mean, you absolutely could. I mean, you could record a video of a brief, absolutely, and overlay it with visuals. That's another, I think, great medium. Yeah. So, Jay,
I think those are wonderful tips. Do you have a template that following all those 10 tips and share with us?
So we'll talk through some example. So I'll show you one that I like that we put together at the Idaho Department of Health. But I'll talk to you about some of the nuances around it too. Because I do think everyone is a little different, which is why I struggle with using some of the Canva or Picto charts, because when you have to modify them, it just you move outside that template, it gets complicated. But it's not that hard. So that's a good segue. Or did you have a question?
As about credibility, what are some tips or ideas that you have for establishing credibility for the person or for the evidence?
So typically, I would say so the messenger matters on these things is one thing I think is really important. So you can talk about your number of years of experience. If you have lived experience around that, you can talk about that. The organization you're affiliated with, you can reference that. You can also talk about the study, if it's a study that you did, and kind of go into that succinctly to kind of say, like, look, we really dug into this. We looked at A and B and C and D, and we came out with this. And just that almost, it's by no means a full methods section from a manuscript, but a little bit of those methods can be helpful to say, like, this was a really good study. This is not just us coming to you. We spent a lot of time digging into this. The more, again, I think if you can talk to your policymaker before the study, that also helps build your credibility, right? Because you can keep them informed about how it's going and so on, then you come back. Typically, a brief is not just emailed to a policymaker either. You're having a conversation with them, and it's what's sometimes called a leave behind. So you give it to them, they might kind of look at it. You might also give it to them as part of legislative testimony or a TWG meeting. So there's other ways. You don't necessarily put that in your brief. There are other ways to convey that credibility information outside of the four corners of your brief. If that makes sense. Got it.
Just talking about the stakeholders a little bit, I can imagine that there's a, so obviously I have no experience in this, but I can imagine that there's a stepwise progression, right? Like you don't immediately talk to the senator. There are probably people that you're talking to at different levels to get to that.
Yeah, it depends. It depends on the level, your like level of, familiarity with the person. Sometimes policymakers have staff who you start with. That is can be very important. When we talk about your key audience, it's not always the elected representative. It could be like their chief of staff, or they're like, if they have like one staff person who that representative then relies on for what they're going to believe. So there can be a little bit of escalation through that, but oftentimes it's like a text from the director of the department of, the division over to a member of parliament and say, hey, we want to talk to you about something. We'll send you a brief and we'll set up a call, and it goes straight to that. So stuff happens fast. It was very fast in this world. So I wouldn't be afraid to go straight to the top. Yeah. All right. We excited now? Yep. All right. So this is an example of a brief. I'm going to talk through a few. We shared this one with you. We sent this out in a second email because I realized that this might be a good one to talk about after I sent that first set to Shirley. So thank you to her for sending out that second email. So we put this one together. This was a bill relating to use of physician visa waiver programs in the state of Idaho. And so there's something in the US law called health professional shortage areas. These are areas that don't have enough healthcare workers. One of them is a mental health HPSA, so HPSA. So if there aren't enough psychiatrists in a particular area, then you get a HPSA designation. You get a HPSA designation, then you get access to different types of programs. One of them is this sort of J1 visa waiver program. In Idaho, which is a state just next door here, it's a lot smaller in population than Washington State. I don't know how the geography compares, but it's a fairly big state. I think it's probably as big as Washington State in square miles, but the population is about 2.2 million. So it's about the population of King County across the entire state. So it's a very rural state. And I was very proud of this one. So we introduced this bill to simplify the application process for this. And it was a 13-page bill where we were editing all sorts of the statutory language around the application process. And we're able to get that 13-page bill just down to this one table. It's like, here's what it says now, here's how we're changing it. And there is a little bit, some of these conversations around, are we accurately, portraying all of these revisions in the bill? And I think we did, but like you have to make some choices around some of the words you have to use when you have that much space, right? So this was a template that we developed for policy briefs. So I have like, 5 to 10 of these on different topics, everything from, we had them for fentanyl test strip decriminalization. We had them for maternal mortality, many other topics. And so the standard format that we use, so we use the style guide for the Department of Health. Many institutions will have a style guide that says these are the colors you use, these are the fonts you use. I think that's very important for having kind of a consistent look with policymakers or other organizations. You've got a title up here that talks about the recommendation, right? This is the goal about increasing use of physician visa waiver programs, right? Everyone had a photo just to the right here. So we use the kind of, the healthcare worker looking photo, right? But we've a different photo that'll match the theme for whatever the brief was. This one, we included a couple quotes. I'll talk more about quotes later, but these are a couple sort of things that we use to break up the text. This is a 2-column structure, right? So we have narrative text up here. Then we've got a data visualization here. We made that using Excel. And this is the density of healthcare workers by county in Idaho. And one thing that we did here, so these are, again, the kind of decisions you have to make with a brief. Initially, when we did it, the highly populated counties were dark blue. And what it did is it sort of visually attracted people's eyes to the highly populated counties, which was not our intent. We wanted to show what the problem is. We actually flipped it. And so like the dark blue is where actually the lowest ratio is of healthcare workers to population. people could disagree about the way to do that, but I really wanted those to pop out to the legislators who represent those districts. Contact information. We have these ribbons. These are called ribbons at the bottom and the top that just give nice, I think, balance and structure to a brief. One of these little tricks that if you you'll start to like look at briefs and like polish things you'll be very critical of them after this session, I hope, because you'll notice all these little things. You say, oh, that looks so nice. So one thing that the graphic designers do, they put a border around photos. So you see that? So there's that blue band and there's that border that goes up. That makes it look much more polished and it's not just stuck on a Word document, right? So this is one, again, it was kind of a simple structure, but allowed us to populate it pretty quickly. We had some key references there. Just a little, bottom label here for the topic. This one, we knew this one was going to get a hearing. We knew there was pretty good support. We weren't trying to capture anyone's attention necessarily around it. So it doesn't have some of the same techniques that we talked about in the 10 tips, but I thought it was kind of a nice example. So in terms of template, I kind of like this one. This was based loosely off of briefs that the Association of State and Territorial Health Officials put out, ASTO, which is a group of, it's a membership organization for folks who work at state health departments in the US. So they put out briefs, their template is kind of like this. And I was like, that is great. So we kind of modeled it on that. Any questions about this one? Should we keep going? All right, let's keep going and then we'll jump into this. This is an example presenting the findings of a research study in Rwanda. This is a PMTCT program. So just some things to point out here. I think they do a really nice job in this and using visual imagery to reinforce key themes, right? So having, I think 2 to maybe 3 sort of visually engaging elements on every page is kind of nice. They convey the magnitude of data using sort of the size of the baby here, right? This is number of children who are infected with HIV every day. They use these are called donut graphs. Have you ever seen donut graph? These are very common. I think they're very nice. You can see some of the things that they did. Dark color here with white contrast, bolded numbers, right? The numbers really pop out. Some other sort of bolding and then an overlay with an image here. These are just icons. You can find these online. Word has them, so I'll show you how to use those. And kind of a consistent theme across the brief. Here's another one. This is related to Medicaid expansion in Idaho. And the reason I wanted to share this one is it has some nice data call outs. It has kind of a simple graph here. I critique that one a bit, but kind of a simple graph. And it has a really nice story on the second page about a family in North Idaho who struggles with health insurance, right, and try to get Medicaid expansion. So this one was very much targeted at rural legislators in Idaho. So it's really heavy on the rural references. They didn't have to do that. That was a choice, right? There are places with higher populations in Idaho, but they're really focusing on rural areas, which tend to have more politically conservative representatives, which are the folks that they need to convince to try to get this to pass. All right, we'll look at one more example here. The graphic designer for this group, the Colorado Health Institute, is amazing. I think I stumbled across this a couple years ago. I just think they do the best job presenting data. We'll talk about some ways to do this, but again, sort of a donut graph here, really simplified graph with bold lettering, talks about the takeaway from the graph. So this one in figure 4, adults under 50 struggle the most with mental health. That was the takeaway. That's the message they wanted the reader to get. There's other information in here, right? They had the little summary right here. Colorado's reported 8 or more days of poor mental health in the past month. So they gave that. The reader can go in here to get more information if they want. They wanted to point that one out, right? So to me, that's a really nice way to do that. And they used the QR code to reference for more information, right? If it's an online resource, you can use a hyperlink. But if you're going to print it out, the QR code is the way to go. All right. Any questions on any of these so far? We're going fast.
Just something quick.
Yeah.
Just to kind of Kate's comment, I really appreciate your comment, Kate. Because I think there is reluctance, even just adults under 50 struggle the most, this takeaway message. Just program briefs that we've done, we've had researchers and faculty like, well, we can't exactly say that. We can't say that because and such you can't generalize and such reluctance to do that. And yet we work with other universities, other organizations, kind of recognizing that this isn't a research results brief or program. This is for a general audience that we're just trying to have this one. But the reluctance to state something like that is really hard. Really hard. Really
Yeah.
yeah. So it's just interesting that yeah. So it's not offensive, PJ. I think my right? Yeah. Yeah.
Yeah, I think, it's a great point. I think there's there's probably a balance that we can strike, right? I think you can take it too far, right? But I have to say, if you get, and I've seen this, like I've watched hearings where they're asking someone who's a researcher a very simple question and they dance around it, right? And it is that, like, sometimes for policymakers and managers, you have to be more straightforward about it, right? There's nuance, and you say there's nuance about it. Here's how you go find that, but and then you can say it, and that is again how comfortable you feel. People are going to be more or less risk adverse. It's an individualized thing, but I do think you got to get it. You have to take some risk if you're going to communicate succinctly, right? If you're not going to do the whole 4,500 words that when your peer-reviewed manuscript, you're leaving some words out, and it's just how comfortable are you with the words you leave out, right?
Really clear messaging type, and that's.
Yeah, they did a great job. All right. Who here knows how to create QR codes or website? A couple folks. Okay. All right. So I will show you how to do this. So I'll tell you how to do this. Then we have their camera. I'm going to test these. So the way that you do this, so it has the dinosaur, because I made these in Chrome, and apparently Chrome, there's like some history around dinosaurs with Chrome, or Google. But you can also like block that out if you don't want the dinosaur. But different browsers allow you to do this. You basically go to the upper right in Chrome. There's a 3-dot thing. There's different variations on this in different web browsers. You do share, and then it'll be create QR code. It's very straightforward to do this. Is anyone able to look these up? Who's doing the one on the right? What'd you get?
You can link a policy brief to a Google Doc using QR.
You can. So that is a Google Doc. So remember I was talking about you can link to a longer paper. Well, sometimes people are going to say, well, like, am I just going to put a paper up on the internet and I have to update a website? You can actually link to a Google Doc, which I've said is one of my GH 523 students who showed me how to do this. The other one? Someone done this one on the left? BIRCH. That's the BIRCH website, right? You say more information here, right? And you can link to BIRCH. It is just a great, I think, way to drive traffic to a website. It is just a really nice condensed way to connect information. So now you should all know how to do this. So you can try, if you have your laptop, you can try to do this. Go to any website, just do share and then create QR code. It'll pop up, copy it, put it in. And it doesn't need to be this big, right? It can be, I don't know how small you can take it, but it can get quite a bit smaller. So in the interest of time, I'm going to jump through this, but this reference is in the slides for today. And I just think there's a really nice article. It says 10 simple rules for better figures. And I think there's just a lot that we've already talked about here, but I would encourage you to look at this. Some of the key things: avoid chart junk. This is just all the excess stuff that we have in charts oftentimes that you don't have to include there for the message to be clear and accurate. And don't trust the defaults. We're going to talk about that in a little bit here too. All right, there are lots of different ways to communicate data. These are just different examples you can look at. Icons are very commonly used now. It's a nice little trick to add a little visual element. These are sort of the key data points. So if there's 2 or 3 key pieces of data that you really want the reader to know, put in your narrative, and then have a little, I call these data callouts. I think people call them different things, but in your brief. This is something they're conveying the size of a particular population. So this was children infected with HIV by the size of the baby, right? It's sort of the magnitude effect overlaid with just the globe. Heat maps, using different types of maps here. Another data call out, which was a key data point that they wanted to convey to rural policymakers. So then graphs, a lot of these are from a version of this Colorado Health Access Survey. And some of the key things that I just want to point out here, again, they have a key takeaway in bold, then kind of your traditional caption or title below that. They simplified some of the grid lines here. So they still have some, but they did dots so they don't interfere with this line as much. They bolded this line quite a bit more, bolded the axes. They gave the data points here. So because they did this, you don't have to do here and then like hold up a ruler and go over here, right? They're just making it easier, right? They're making it easier on the reader. Again, here, including the data value, really with bold, high contrast, white to dark background here. And kind of similar over here. So a lot of it is simplifying, bolding, and then including that key takeaway in the message. Stories are another nice thing to include in a brief. So these are just different examples of quotes. Here's that story with a photo from that one. This is a quote that we had from a critical access hospital CEO. These are from the Colorado Health Access Survey, some quotes with also a name and a title and a photo to even just kind of connect emotionally a little bit more with an individual who has a lived experience around the issue, right? So these are all little techniques that you can use to try to tell stories and connect through, just, a little corner of your brief, right? All right, so let's jump in and look at Excel here, or Word and Excel. Any questions on anything I presented so far? All right. Sorry, did anyone raise their hand? I was looking down. No? Okay. All right. So I'm going to pull up, I'm going to do two things here. I'm going to pull up a blank Word doc. And I'm going to try to, all right. I know what I got to do. There we go. Okay. So for the columns, like I said, I like to think of them as either 2 or 3 columns. You just go up here, layout, columns. Just go down here, 2 or 3. 2 is probably good. You don't want 3 columns of text. I think that the rows for each line of text are end up being too short for that, I think. Just do 2. I'm gonna do one other thing. I'm just gonna turn on, if you click this little paragraph thing, it'll just show you a little bit more of your formatting. I'm gonna do one thing before Shirley texts me. I'm gonna share my screen with the Word. Okay. All right. And then, so you've got your columns of text here. Generally speaking, to create that that template that I kind of showed you before for the physician visa waiver program, what you're going to do is you're basically using text boxes, right? So to do that, basically you're going to do insert shape. Going to create a text box here about that high. One other tip, I didn't put this in the slides anywhere, but depending on how much how many figures and graphs and photos you have, you're about, if you're doing single space, for a 2-page brief, it's about 1 1/4 pages of single space text. Once you put all those figures and text boxes in there, that fills it up. So it's about 600 words of text, maybe, that you can fit on a brief. The other thing here, so you can do layout margins. I would make all the margins 0.5. If you start getting any more than that, you gotta double check your printer and make sure it'll print. One other thing, so to move these text boxes around, you've gotta click this little arch here with the lines, and you wanna, I generally speaking do tight here. It just allows you to move it. Otherwise it's gonna get stuck. So do that. And then I was gonna show you a few other things here. So you can insert, we'll do pictures. We're gonna do stock images. So if you have Microsoft 365, and here's some pictures of healthcare workers, we'll do that. We're gonna insert that here. Again, you gotta do tight in order to move it around. Being a bit slow here. So you do tight, and then you can move that around. You can move that up to the top, but if my computer wakes up. See if that helps. Being a bit difficult. So I may not be able to move it around here, but I'll show you how to insert some of these other things. So you can do, if you want to add an icon, you do insert icons. And again, this is MS Word. There's different variations on this. And then you can put in a search for what you're looking for. So you have mental health, right? So this is sometimes depending on the background that you're using, you might either want to have a little more white or sort of black. Again, it sort of depends. Let's see if it'll allow me to do this. And then you can move it around. You should be able to move it around. It gets sort of getting, I think the presentation mode is kind of messing up. But so that's how you do icons. You can then do, so if you want to do those data callouts, I'll show you that, and then we're going to go to Word here in a minute. So you can just do an insert text box. And the way that a lot of this works is you're creating everything with text boxes, right? So yeah, for some reason it doesn't like I wonder if there's a MOOCs plugged in someplace else. So you can basically put your data point in here. So I can't drag it, sorry about that. But let's say you want to do 38%, right? You're basically just going to do that and go in bold. Yeah, the clicker's not working in this guy. Demo that. Basically bold that. You can then overlay that with your description of 38% of people had, depression in the last of this population had depression in the last year, right? As an example, you can overlay that, and you're basically just laying this out with you put the little ribbon on the bottom using text box. You change the color of that to use the shape fill to match your style guide for your organization, right? So you want to have that like RGB code. You can match any color for that. You want to have probably one picture, maybe one data visualization per page. Don't overdo it. Kind of 2 to 4-ish. So you've got these key points that are really jumping out, because you kind of want the reader to be able to remember maybe 3 to 5 key things about the brief. So if you have 10, if you have 6 or 7 things on the front and 6 or 7 on the back, it's just too much. I think people have a hard time recalling that. So those are just the basic ways to do to use Word. Any questions about that? Doesn't work quite as well since my keypad isn't working here except for clicking, but that makes sense? Yeah. If you're using the stock images, you can look at the license. I don't think you have to. There are, so like Unsplash is another, it's a very common one. I think PictoChart leaks the Unsplash. There's like rules in there. Sometimes they ask for attribution. There's a website called Flat Icon. I want to say it's like flaticon.com that has tons of icons that artists contribute to there. And if you do the paid subscription, which is not much, then I don't think you need to attribute the author. If you don't pay, if you do the free, then you're supposed to attribute the the author of that. So you just look at the licensing for whatever system you're using. And it does vary by subscription level. So look into that. All right. It's a good question. Any other questions on Word? Does that make sense? Right. So it's basically just you're looking at a brief, find one that you like. Think about I can create all those things with text boxes, right? You can rotate them, different colors, insert images, right? Okay. Should we look at how to do maps now? That's the fun part. All right, we'll see how this goes here.
100 words for a 2-page brief.
Ballpark. Yeah, it depends on, again, like tables and other things. But when we would create them at the Department of Health, that's what we would say. We'd say, give us 600 words, and we'll start with that. And then sometimes you can get creative about how you do that. All right. Okay. So I opened that sample data file. And so in here, so there's a couple different things. I know we're pushing up against time here. I'm assuming we can go over a little bit. People, if you need to go, feel free to walk out. No concerns from my end about that. So these are, yep.
Like evaluation. So I think there's a QR code at the end on one of the slides, but we can also surely send a link
It's
to the evaluation. Just really want to hear people's input for future sessions.
yeah, absolutely. Yeah, thanks, Lydia. So this sample file, I just went online, I pulled some subregions for different countries, right, in different regions. So these are US states, these are counties from Kenya, these are districts from Sri Lanka, and to get all the way over, it's countries in the PAHO region, right? And so what you can do is, if you go up here, those of you who have it open, if you just left click on the top, we'll do this US, and then the hypothetical data values are literally random numbers that I put in, just to have some variation, right? But that could be prevalence of something, incidence of something, right? So imagine it's some sort of a public health outcome for that. So if you select the top one, scroll down here to the bottom, so go to the right, so you're capturing the jurisdiction, which is like the state. Jurisdiction is like a region, right? And then the data value. And then you go up here and you click insert. And what we'll do it this way. You can do maps over here. Here's kind of a shortcut, but I almost always do recommended charts because I always like to see what they recommend. And if this works, there you go. Bing automatic. So one thing is, so this uses Bing. So I've only used this with like public data. If there's sensitive data, obviously personally identifiable data, you need to be much more careful. So make sure you understand how it's used and so on from a data security standpoint. But for publicly available data, you can just do this, and Bing automatically recognized this as US states. I didn't have to put that in anywhere. They said, oh, those are US states. We'll put that in a map, and it shows this variation of in color here. So we're going to do that one. Then if you want, again, we want to match the color scheme of the brief. So we could do, and there's different ways to do that. So you can do, and you can change any of these individual ones. You can go, if you click that little paintbrush, you just do color. You can get some different options here. So this is sort of that's kind of bright. And then if you go, how do I change these colors? You can put in your individual RGB code for your style guide. We'll do purple, right? And then you can modify this however you want in terms of colors and size. You can take off the series here. So yeah, if you right click, which my computer doesn't want to do, you can take this off. You can change the series title however you want. So it's kind of like basics of Excel there. So let's look at another one. So you might say, well, those are US states, right? What if we go outside the US? So here are Kenya counties. I'm going to do it the reverse way I just did. I'm going to grab the data at the bottom, scroll up to the top. So I've got the jurisdiction and the data value. And I'm just going to go insert, recommended charts. And there's Kenya with a variation by color. There are a couple in here that aren't showing up for some reason. Bing didn't recognize some of those. I'm not exactly sure why. I haven't really looked into that. But it's pretty good in terms of capturing the different graphs. So another one, so districts, right? So even I think there's a level of governance above districts in Sri Lanka, actually. So this is a very much sub-region. Same thing, highlight them, recommended charts. Here's Sri Lanka. You got all that all breaking out right here. And then lastly, we'll do all the countries in the Pala region too. So some of these, like I had to find them online and insert them into a table. It took a couple minutes, but not that long. Just gonna do insert, recommended charts. If you do this the first time, it takes like Bing has to like turn some wheels. It can take like 10 to 15 seconds. So like, what is this that we're looking at? And then it'll pop this map out. So it's going a little bit faster now, actually, just because I've done this before in testing this out. So I think Bing has already sort of recognized this or coded it. So then you can do this. Now for this thing, I'm going to show you how you can put it in the brief. Because there's two ways to do that. One, you can copy it and you paste it in with the metadata, which is the underlying data in the file, so that actually if you were to, you can actually link it to the Excel sheet. So if you were to change the values, it automatically change it in your brief if you really wanted to. If you paste it in with the metadata, so with the formatting in Excel, that is the best resolution that you're going to get. You can also use the snipping tool, and while you can have a little bit of degradation in the resolution, it allows you to adjust what you put in. So the snipping tool is like one of the best tools in all of computing, I think. I use it all the time. And so what it's basically just doing is it's not a full screenshot. It's just like a mini screenshot of whatever you select in here. There's different ways to do it. But let's just do screenshot here. You get this thing, shut up my other screen here, move it over. Get this guy, and there's a version on Macs for any of you on Macs. I can't remember what the shortcut code is on Macs, but there's a way to do this. You just do new, and then because we've got all this gray area here, so you may not want Europe and in Africa and Asia for this one if you're just focused on PAHO. So you can just select this, then you can right click it if, oops. I don't want to do that. No, hold on. Do that again. Do snipping tool, new, select. Turn that off. Copy. I'm going to go back to my brief. And then you can just paste that in, right? And you can see, I don't know if you can see back there, the resolution got off a little bit here, and there's a way to use the snipping tool so it doesn't actually have to be a rectangle. One of the options is you can actually draw around it, so you're just getting that. It can be a great way to insert images. So if you find a really nice graphic that you like in Canva or PictoChart, but you don't use the whole template, you can just snip that little section you want and put in your brief. Just be, again, thoughtful about the resolution, because if it starts to look fuzzy, that can negatively affect things. So for graphs, I'll just do this very quickly. Again, you're just selecting the date. So this is like a time series graph. And we're going to do insert recommended charts. We're going to do this guy here. And all of this, so if you click it, and mine's being a little difficult here with right clicking, but you can just change the font for all of these things. So the basics are just bold it, simplify. So you don't need necessarily the full range of data over here that you have. You don't want to be misleading about how you present it, but you don't necessarily need all of that. So you can go to bold for that, right? You can make the font a little bigger. Have that pop out a little bit more. You can add data labels to this if you do that. And if you right click, let me right click. Data label. You can add that there, right? You've got that data label. And then again, bold it, make it align with the color format of your brief. And that's basically it. So these are all, and I've talked to people who do, data visualizations in public health departments, and there's, what the guidance they've given me is that there's everything that you need in Excel to make it look very polished, but you just need to take the time to adjust the formatting to kind of match what you're seeing in some of these other briefs or reports that you think looks really polished. So I've given you some examples. You can go in there and say, well, how do I get it to look like that? And there's a way to make it look exactly like all those ones in the Colorado Health Access Survey. And so by going through this process, there's nothing magical about it, right? Keep it succinct, short sentences, really be clear about your recommendation, use these visual tools, pull it all together, guide the reader through it, keep it to 2 pages, reference another secondary source for references or maybe more nuanced analysis. And then ultimately, it's typically having a conversation with the policymakers and having that as a little lead behind that you can share with them so they can then follow up with you.